Well, hello, Sonoma County, and happy holidays and merry everything. This is Dr. Tom on Ask the Expert, and we have our show co-host, Karina Lozano here. Hi, Karina, how are you?
Good, it's been a while.
It's been a while since we've had you on here. I'm glad to have you back. The fans were writing in and saying, where is Karina? And our program director, Jeff, how are you?
Doing all right.
Doing all right? Well,
all right.
happy holidays. We doing all right?
Oh, yeah. Did
Doing
you guys
great.
have a good Thanksgiving?
Yeah, we had a wonderful Thanksgiving. In fact, I'm glad that you mentioned that because that's sort of the topic of the show. Who overate on Thanksgiving?
Yeah, definitely.
Everybody's right. Yeah, okay. So what were you eating mostly, Karina?
Lots of pozole.
Pozole.
Yes,
Oh,
yeah.
I like
we
that.
Very traditional.
Okay, I way too much dressing. I can skip the turkey and eat. How about you, Jeff? What were you eating?
Oh, I was ODing on pumpkin pie.
On pumpkin pie. Okay, so that brings us right into our topic today. Karina, we know you're our surgical liaison. People are calling in, and we've been pretty busy this year with
Yes,
people.
we have.
We thank all of our patients for trusting us with their care. And for those listeners here, we appreciate that. Now moving on to, 17 years here on KSRO. We appreciate you listening to us every Thursday at 12:30. Karina, what seems to be, I know this is a lead-in, we just talked about Thanksgiving and eating, but what seems to be kind of a popular concern when people are calling in to talk to you about possible cosmetic surgery?
We all don't want a Santa belly. We don't want the Santa belly.
All right, so no Santa belly. Okay, I would agree with that.
Yes.
In fact, I've been telling people that I look a little bit like a Vietnamese pot-bellied pig. I got my little pot belly, my skinny arm and legs that are running around the house here. It's not a good look. So,
Yes.
so that's been a concern. People seem to be calling more often
Yes.
regarding their abdomen.
Yes,
Okay,
yes, of course.
already. What seems to be their biggest concern? What's the pain when the patients are calling you to talk to you? Because it's a big deal to call you and
Yeah,
talk
of
to you.
course. Patients are, they're working out, they're trying to eat better, and they're pretty much good shape, but they say, and it's just my belly, I'm on my Peloton, I feel my belly's hitting my knees. It's not a good feeling, so.
No, that's interesting. You should say that. We had one patient recently who did mention that when she's working out and
Right.
cycling, that she can feel her belly on her legs, and it's not a good feeling.
Yes.
I can certainly identify with that concern. All right, so they call you up and they say, I'm feeling that. Are there any other areas of the body besides the stomach? We'll call it the tummy or the stomach area that they are concerned
the
about.
muffin top is also an area that a lot of people see, men or women, when you're putting on your jeans and you fade a little bit too much, and now you got to loosen them up because you're not fitting in them. But that area seems to be a concerned area for patients.
Absolutely. Just a little personal side here. Today's a great day in our office at Dr. Tom Cosmetic Surgery because we're having our holiday year-end
Yes,
dinner,
right.
and we're going to be over at Salt and Stone out in Kenwood. Love that place. And we're going to go and celebrate, and it's a lot of fun. I always wanted to be an event planner, I think, in my other life. So got a lot of neat little surprises for the
Yeah.
team, and I'm very happy about that. Getting ready for that, of course, I'm online like everyone else, social media, and they've been popping up with all these, Christmas clothing, ugly sweaters, cool suits and all. And I ordered one and it was too tight.
Oh.
and I'm thinking, okay, it's because it's those cheap brands that I'm seeing on Instagram. That's why they're too tight, but I have a feeling that it's me.
Yeah, I just blame the dryer.
You like the dryer, okay. So when just even talking out of my own concern, and as we get older, and even though I've always been relatively slender and have paid a lot of attention to healthy lifestyle, exercise, and eating, it does get harder. Our metabolisms change. Sometimes when, especially even young ladies, when they become mommies, that happens. They begin to accumulate fat where we don't want it. And it's not so much that we're thinking, hey, we're against fat and so forth, and trying to make body shame people at all. Not at all. But really what it's about is what do we ourselves as individuals feel comfortable with. And I do understand that when we put on our clothes and all of a sudden it seems like it's tight, or you lose a button, you're wondering what the heck is happening, right? So they call you, Karina, and they're looking for, they have questions, what can you do to help me? What is usually the next conversation that you have with these patients?
Yeah, so usually, we talk about whether they have kids, kind of their activity, what is your activity level, what are the main areas that you're seeing increase of fat, and then we ask them to send us photos. Photos say a lot. They help us kind of guide the patient to see if SmartLipo is a good fit for them.
Okay.
So photos are always awesome, and then of course pricing. Pricing's always important
always
for
talk to you about pricing.
patients, and downtime. Downtime's a big one.
Perfect. So let's see if we can cover all those,
Yeah.
and we have about 20 minutes. Let's see if we can we can cover all of that. So patients call, and of course they're concerned with their body image, and as I said, no body shaming here. What I do find, and what I try to help our patients with, is sort of that self-denigration of feeling bad or guilty, like, oh, I have this and I work, and I'm not working out enough, or I haven't run 5 marathons this week, and I'm not on some crazy diet where I'm only eating air. And I try to help them to say, we need to live life. Breaking bread with our friends and family, to me, is a really important part of the enjoyment of life. We're meant to be social beings, and that's important for us to do. But usually it starts with a little bit healthier. If we're really true, honest with ourselves, we begin to realize that, I didn't really need to eat that whole bag of Ruffles with the ridges. Okay, that's my downfall, all right? So, what I need to do is maybe I treat myself once a week to that, or twice a week, but then I'm not doing that every day. I usually recommend to patients not to look at themselves and say, I need to lose 30 pounds, but to look at themselves and say, I need to lose 3 pounds in terms of just getting healthier. If we think of health, we're going to look better, okay? If we make the changes to be healthy, we're going to be better. We're going to look better. We're going to feel better in our clothes versus I need to lose weight, okay? Another way to look at that, I need to build muscle. If instead of looking at our weight and we say, I can tell, especially me being an aging baby boomer, that I'm beginning to lose muscle mass, I gotta get into the gym and pump some iron, is get in there and start off slow. You don't need to try to keep up. Like I can't keep up with Jeff, I'd made Jeff's a young man, our program director, there's just no way. In fact, I'd usually wait for him to get done with his workout. Then I'd sneak into the gym and I'd work out so that I wouldn't be body shamed or age shamed by Jeff. So just little things like getting back into some more active lifestyle is good. A few things can be what I'll tell patients, especially those who are sedentary, is I'll tell them a very simple thing to do is after dinner, most of us, we sit down and we watch TV, right? Instead of doing that, I tell them, put your watch on and go out for a 10-minute walk. Walk out of the house for 10 minutes. And so you walk out 10 minutes and you got to come home, right? So you turn around and you walk back the other 10 minutes. So all of a sudden you've just put 20 minutes of walking. And you don't have to go and run a marathon, but just getting yourself back and going. Let's beat inertia instead of sitting down and having inertia. Let's keep moving and make it harder for them to keep us from moving and being active. So that's one thing. The other very simple thing that I recommend to our patients is a diet that I call Dr. Tom's I'm not going to tell you what not to eat diet. So I'll repeat that again. It's Dr. Tom's diet. I'm not going to tell you not what to eat diet. I know that was crazy. But basically, I'm going to tell you what to eat. So what I recommend is that you eat 5 fruits and vegetables throughout the day. Notice I didn't say don't eat this and don't eat that. So, and when we talk about that, I'm not talking about a salad meaning 1 vegetable. Okay, salad's 1. Okay, an apple's 1. It's not 2 servings. What you should do is, if we fill ourselves up with healthy, green, leafy vegetables, whatever it may be that really is something that you enjoy, you're gonna have less space in your stomach, in your organ, the stomach, to eat more. It doesn't mean you still can't enjoy the other things that you like, our little guilty pleasures, if you will, but really trying to just fill yourself up with good, healthy foods, that's gonna make a difference. So, we encourage our patients, again, for healthy lifestyle. Okay, and, maybe after the holidays, right? It's always hard during the holidays, but hey, you can still go out for that 10-minute walk after your Christmas or Hanukkah dinner, right? Okay. So having said that, now we evaluate them, and you've asked them, Karina, to send in the photos. So what in particular am I looking for that you see, or when you first have them send it to you and then you forward them to me?
Right.
What is it that you're assessing? Because you're our surgical liaison and you're trying to get the patients who are going to get the most benefit from a procedure, what is it that you are looking for?
So I am asking the patient what their weight is. And I am calculating their BMI to make sure that they're first within that range, and that we don't have to say, you do have to do a little bit further weight loss before we even consider surgery. So that is always the first step. But then we're really looking at, the quality of the skin, how much actual fat we're working with. Sometimes it's mainly skin. There's not much fat there. So that's kind of what I'm looking at and forewarning the patient about.
Right. So we're looking at BMI, and usually we say a BMI of 30 or over, that we need to look at some more lifestyle changes before we consider liposuction or SmartLipo as an alternative for body contouring. And the reason that we do that is not because we're saying, oh, you're too heavy for surgery, but we want you to be happy. And we find that people whose BMIs are really high, and we do even if we use our laser, and we're doing laser lipo, which is called SmartLipo at Dr. Tom Cosmetic Surgery, that the patient's expectations are not going to be happy with the results. The patients are part of the team, and I stress that to our patients. You are part of the team, and we want you to participate in you getting the best results for you. All right. So it's not that, oh, I'm too fat to have my fat suctioned out. It's just that we want you to get the best results. So we need to work on that overall BMI of bringing it down. And there are certain exceptions that we can go over with the patients in terms of where it's acceptable to be a little bit higher. But we really want you to be in the best shape possible in order to get the best results. The patients who do the best are ones who have just pockets of fat where they don't like it. For instance, it might be in the front of the abdomen, okay, or it might be the muffin top, or what we call the flanks, and those are the areas that we want to work on. And it's amazing the results that we can get in terms of restoring the patient's contours or their more youthful figure. We just actually did a Zoom follow-up on a patient who was from out of town, and she's in the medical field, and I'm really proud of her. And we just did her, she was a soccer player when she was younger. And then she noticed that she was starting to have kind of an increase in girth that she wasn't liking. How old was she?
Pretty young, in their early 30s.
Early 30s. I think she might be 32 years old. So she's a young gal. Okay, and then she was just noticing kind of the bulge in that area, and she was not a mommy, and so she just sort of something that was accumulating. Probably part of it was that she wasn't playing soccer 5 days a week when she was on the soccer team, and she's noticing these changes. So we did her procedure just 3 weeks ago, all right? And so we did SmartLipo, and let me explain that to those who maybe aren't familiar with that. We do all of our cosmetic procedures under local anesthesia. And what we do is we first inject local in the areas of the fat, so that'd be in the front of the abdomen or in the muffin top area, in the back area. And then we take a laser, and we run the laser underneath the skin to try to get a smoother result of the skin. We do get a little bit of skin tightening. It doesn't replace, if you need a tummy tuck, you need a tummy tuck. But if you have kind of a little bit of laxity, it helps to improve the end result. We then liquefy the fat, and then we suction out the fat. So that's the procedure that we do. And so we did this for this young lady, and we removed the fat from the front of her abdomen and her sides, or what we would call the waist. Put your hands on your hips, I would say, and that we call it the waist, and then the muffin top area in the back. And she got an amazing result. She was actually shocked.
Yeah, she was very happy.
She was very happy. In fact, I think I sent her before and after photos as a comparison.
Right.
And she had a conversation with her mom. What were they saying?
Yeah, they couldn't believe it. She said, I can't believe that was me.
Right. And, we don't realize that because we have optimistic glasses on, like, oh, I don't have a muffin top, it's bulging over the back of my jean belt here. Okay, so you can tell I'm older. I wear a belt with my jeans sometimes. Do you wear a belt with your jeans, Jeff?
Yeah.
Oh, you do? Oh, you're getting old.
I mean,
Jeff.
it's more like khakis, but like not jeans.
All right. Okay. So and then she noticed a big difference. Especially we always send you home with your before photos so that you don't forget, because it's amazing how quickly
Right.
we forget what we look like. And so you can get some really, really nice results with that. So this young lady, and we can use her as an example, we did the procedure about 3 weeks ago. What was her post-op course recovery like?
Yeah, I think she actually went on vacation. She did.
You know, the patients don't tell me everything. They tell Karina everything. And where did she go?
I don't know, but she went somewhere fun, I guess.
Okay, with her boyfriend.
Yeah, for
okay.
the family holidays.
Okay,
but,
alrighty.
yeah, I think for herself,
Right.
she was actually very compliant with her aftercare instructions, and as far as wearing her garment, and she followed her rules, and she's still wearing her garment.
Right.
And I don't think she experienced as much discomfort. She's pretty tough.
She's a tough
she
gal.
she's tough, but
Yeah, women are the toughest, and you know, I know this is a characterization, but guys, we're the weenies, okay? Women usually do very well with this procedure. And for post-op pain, we write them a prescription for what?
either whichever one you Percocet or Norco, so whichever narcotic that you
so
prefer.
we do write for that. If you're younger, we sometimes write for gabapentin, which is a nerve stimulator blocker, and also Tylenol. And this young lady maybe took a pain pill or two, but then she was very quickly on to just acetaminophen or Tylenol for her pain discomfort. A key is wearing that compression garment, and that's so important to get the best result. So how often what is our recommendation for our patients?
Yeah, so our recommendation is going to be 2 weeks mandatory. Around the clock.
24/7?
Yes, unless
Okay.
you need to shower or wash the garment itself
Sure.
if it gets soiled. And then an additional 4 weeks after the procedure.
So 24/7 for 4 weeks
No,
now?
so just during the day for the additional 4
Okay.
weeks, if tolerated, for the best results.
Right.
You know, she's obviously going to wear it for a lot longer, and
Right.
she's very happy, so.
Right. Okay, great. And she is. And in fact, she related to us that our young lady that we're talking about related to us that she has to get a new garment because the garment that she bought
Right.
originally is too big
Yes.
now. You know, at first it was fine when she had some swelling, but now as she's beginning to shrink wrap down, she's finding out that she's going to have to, get another garment that's a little bit tighter to help to continue that compression. Absolutely, compression is so important, as is the surgery, but compression is really important post-operatively in terms of getting us the best contour and the best figure for the patient. So she started to do that. What else? When did she go back to work? She went on vacation. I didn't know about that. When did she go back to work?
That is a good question. I actually wasn't there for her first follow-up, so I'm not quite
Okay,
sure.
so she actually told me that she went back to work in about a week.
Okay, that sounds about right.
So she went back to work in a week, and she is a pre-nursing student. Right now, I believe working more as an assistant, and so she's really excited about becoming a nurse, and I think she's going to be great. I think, and so she went back to work, and with the restrictions that we didn't want to do any patient lifting for about a week. So for those of you who are thinking, hey, this SmartLipo done under local anesthesia, quicker recovery, less post-operative discomfort, all of those are very, very true. But what can I expect in terms of going back to work? So what do you usually tell them? Let's see if we're in agreement on our recommendations.
I like to tell the patient, depending on what they do, to give themselves up to 2 weeks flexibility. So take the full 2 weeks. If you can go back sooner, great. At least you have your 2 weeks. And then it could be 1 to 2. So within that time frame.
Okay, so you're being pretty conservative,
Yes.
conservative in terms of your recommendations, and I like that. What I do tell patients is if you take the time to follow your post-op instructions, if you take the time to give your body the chance to recover, your overall long-term recovery is going to be so much quicker than the person who says, nope, I got to get right back to whatever I'm doing,
Right.
and then their post-op recovery is prolonged. So it does make a big difference. Please, if you're going to sign up for any kind of cosmetic procedure or any kind of surgery, period. Okay, I had a hip replacement, and so I set aside time for myself to recover. You're going to be so much better off in terms of long-term recovery, and you're going to recover more quickly, actually, if you take that initial time off. So what I tell the patients is that if they have a desk job, they can probably be back to work in a week.
Right.
So if we do surgery on a Monday, they could be back to work in a week if it's just a desk job. If you're working remotely, you could probably go back even sooner. It really just depends on the patient's individual discomfort
Right.
tolerance, okay? Everybody's just different, okay? If you're a woman, you get back to work sooner than a guy. I think, okay, because you're just tougher. Alrighty. So, having said that, if you're doing heavy lifting, let's say you're in construction, or you ride a motorcycle, or whatever it is that you might be required for your job, I agree with you. I think telling them 2 weeks is a good thing. Now, I will tell you that most people, after having SmartLipo, are driving in a couple of days on their own. As long as they're off of pain medication, they're driving on their own. Most of them are walking around and doing their daily, normal daily activities, really without restriction. A little sore, of course, because you had a procedure. But in terms of going back to the gym and working out, I think that 2 weeks is a good recommendation. So I agree with you on that. Good. I'm glad we're telling the patients the same thing. So afterwards, Karina, what is their follow-up like with our office?
So usually there's not much to see with SmartLipo until about 2 weeks. We're following up closely with the patient, but as far as them coming into office, we give them 2 weeks before we have them come in, and we actually make sure that everything looks good. And of course, if there's any issues, they can always give us a call.
Come in sooner.
Yeah.
So what I will tell our patients, Karina, when we do SmartLipo, especially the abdomen and the flanks, I'll tell, and you're correct in terms of our follow-up. So I call my patients the evening of the surgery. I call them the next 2 mornings. And it's just my protocol of just keeping in touch with the patients, letting them know that we are here for them for any of their questions and concerns. I learned a long time ago that communication is key. So communication between your medical team and yourself is important, and both of us have responsibilities. Don't not call us if there's an issue or any concern. And if you love us, call us all the time and tell us that you love us. But it's important that we communicate. So we keep that open, the lines of communication open. I also tell the patients that in the first 48 hours, actually a little bit different than maybe what you told them. In the first 48 hours, they're going to take off their garment, jump in the shower, look in the mirror, and they're going to say, wow, oh my gosh, what a difference there is in my body figure, my contours. Okay. Then at about 36 to 48 hours, just the body's response to having surgery, they're going to swell.
Right.
And in fact, then even over that later part of the week, they may be saying, God, did Dr. Tom even do anything? Okay, because they're swollen. It's called post-surgical swelling. But that will go away. At 2 weeks, you are absolutely correct, Karina, when we see them as our routine, our protocol, that at 2 weeks, they'll get a pretty good idea of where they're at, okay? But they're still swollen, okay? We did a Zoom follow-up with our young lady at 3 weeks, and she was still swollen, even though she was uber happy with her results, that you could see the swelling still. And she was kind enough to send us photos, post-op follow-up photos. So I tell patients even at 2 weeks to expect improvement. What they'll do is they'll do massage, just taking their hand and massaging the areas that we worked on, that lymphatic massage. That will help them to get a better result. We're in the compression garment for a total of 6 weeks, 24/7 for the first 2, just during the day for the last 4 weeks, right? That's all important. And that for them to increase their activities, all of that is really important for them to get their best result. Is there anything else that we try to encourage the patients in the post-op period?
There's not a dramatic weight loss, but just kind of, we encourage the patient to either, if they need to, if not, then to lose maybe a few pounds, or just maintain because then they'll maintain their results. So we still want them to become physically active if they're not, or maintain their physical activity.
So typically what happens, they kind of run in thirds. So a third of the patients, they maintain their weight, and that's great, and they're happy with the results. A third of their patients may lose a pound or 2. You notice we didn't say 10 pounds, 20 pounds, 30 pounds. We said a few pounds. Really, if you can lose 2 or 3 pounds, they're really stoked about the results. They love the results because it's dramatically improved. Unfortunately, there's about a third of the patients that say, I had this procedure done, I'm going to kind of not worry about it, which means they're indulging, for the next few weeks, and then I'll be good. Or they may say, hey, I just paid this guy money for contouring my body, and I'm going to take advantage of it, and they don't try to improve their lifestyle. And they're not going to be as happy. So that's part of being the team. The patients are part of the team with us. Okay. So overall, that is, I think, a nice summary. So if somebody's interested in body contouring, especially after the holiday, and they want to get together with us and talk about that, it's very easy. Talk with you, Karina, and all of the conversations are confidential. We'll have you send photos. We'll set up for either a Zoom consultation or in-office consultation, and we will be really excited to try to help you to get, the more youthful, healthy-looking physique that you desire.
Yes, of course.
And we all want to wish you, again, a very merry everything and happy holidays as we end our show today. Thank you, Karina. Will you come back?
Yes, of course.
All right. Thank you. And
Thank you.
everybody stay safe out there, and we will see you next week, and we will listen to you and talk to you next week on KSRO Ask.